This is Dr. Steve. Feel inspired.
This show is going to change your life.
Feel connected. Feel better.
Feel better is not just a slogan for the show. It's actually a challenge, a mission, and a promise from me to you to help you live a healthier life.
This is Dr. Steve.
Women who have pain during sex and also have varicose veins in their legs may be surprised to know that the two are often related. Well, joining me now is Dr. David Greuner. He's a cardiovascular surgeon. David, welcome back to the show.
Thank you, Dr. Steve.
So explain this to me, how these two conditions fit together for people at home.
So the same process that causes varicose veins in the legs, which is underlying venous reflux or leakage of the veins, causes problems in the pelvis as well, as the veins are connected down to the legs.
So in other words, basically the veins in the pelvis are congested and that can cause them pain?
Correct. It causes swelling, causes distension of the veins in the pelvis, which compresses the organs around in the pelvis, which is an enclosed cavity.
All right, so basically the telltale sign is pain not related to your menstrual cycle?
Correct. This is a mechanical problem, so it's not related really to your menses.
All right, so if you're having that kind of problem, get a good idea to check it out because it could be related to your varicose veins. All right, so let's talk about how this is treated and how this procedure is done. We have this animation. Explain this to us.
Okay, so as you can see, it's zooming in on the pelvic organs, and these veins that are flashing red are the inflamed veins, which are typically around the ovaries and fallopian tubes. Often these are associated with varicosities and bulging veins down lower in the pelvis or vulvar area. So we go in and we access one of the veins in the legs. As you can see, the catheter going up through that vein all the way up into your abdomen and coming around down to the vein that supplies the ovaries and the reproductive organs. We find the vein that is leaking too much. We deploy this occlusive material into it. It's similar to a glue. It's biodegradable, it stays in, but it cuts off the extra blood flow to the organs, bringing back and restoring normal blood flow.
So basically you find that problem vein with this catheter, fish it through, and then block off the blood supply. What happens to that vein once you do that?
The veins shrink back down to their normal size, and they stop compressing the organs and relieve the patient of pain, which is typically immediately afterwards.
Right, immediately after. Now, where is this done? Is this done in a surgery, in an operating room? Is it done in the office?
This is done in what we call a hybrid OR, where we have x-ray guidance as well as ultrasound guidance. So we can use real-time image guidance to see exactly what we're doing without making a cut anywhere on the body.
Now, the person's awake?
They're awake, but typically sedated, so they can lay still. Yeah.
Okay, and what kind of recovery time are we talking about for something like this?
They can go home immediately post-operatively, and typically they can resume activities the next day.
Fantastic. So what is the chance of someone having a recurrence of this problem?
It's quite low, and if adequately treated, it should be less than 5% recurrence, and it should happen slowly.
Slowly, so over time, because some other veins might become congested or cause problems?
Correct. All blood vessel beds have what's called collateral flow, or other ways for blood to get around, but typically if it's addressed completely and entirely, it's very low recurrence.
All right, Dr. David Greuner, thanks so much for coming. It's great information.
Thank you so much.